Over the last few years, EU-IPFF has carried out a benchmarking survey of the care received by pulmonary fibrosis patients and as viewed by patients and clinicians across Europe. The first, information and self-management resources. There's clearly, as you can see here, we have a traffic light system where green is generally good, yellow is there are some problems in services that are provided, and red is where there are significant problems from the perception of patients and clinicians. Well, if you look at the info and self-management box across something like 18 countries that this survey was done with, we see there's a lot of problems. A lot of patients feel they get insufficient information and insufficient help with self-management. Now, turning to oxygen supply, we can see again with oxygen supply, the first line relates to the availability and access of oxygen, supplementary oxygen, and that seems generally good, but the extent to which the patients are reimbursed for oxygen is a major issue in about a third of the countries covered by the survey. So we have a situation where there is access to oxygen, but whether all patients can afford to buy it and get reimbursed for it causes problems and causes anxiety, and in some countries means patients do not get adequate access to oxygen. And pulmonary rehabilitation, similarly, availability and access to pulmonary rehabilitation is unfortunately not that great, and nor is the coverage of pulmonary rehabilitation. So basically, roughly half of the countries of Europe, patients and clinicians report that pulmonary rehabilitation services are not adequate. And surprisingly, some of these do include high-income countries like Spain and the UK. Now, thinking about the topics of the various sessions today, on pulmonary rehabilitation, it's really encouraging that over the last 5 years, there's been evidence, research evidence has come forward to show the value of pulmonary rehabilitation courses, both physically, in terms of health and in terms of mental health. And this is certainly attested to really strongly by all the patients I speak to and by my own experience. My life in the last year before my transplant was transformed by doing regular pulmonary rehabilitation. I just wish somebody had told me about it and I could have started it earlier. So generally, I think there's a huge unmet demand for PR. I mean, even in countries like the UK, where 50% of pulmonary fibrosis patients report they've had some pulmonary rehabilitation training, that means over half have not. And the UK is probably a leader in the numbers of people in this field. So there's a huge issue of unsatisfied demand. But there's also an issue of the type of course. Generally speaking, pulmonary fibrosis patients go on general courses where the majority of the participants in the course have COPD. This means that many of the education sessions, while the exercises are fine, they're the same. Many of the education sessions are not relevant to pulmonary fibrosis patients, and we miss a real opportunity if we don't run dedicated pulmonary rehab for PF patients. And that opportunity is the opportunity for pulmonary fibrosis patients to come together, get to know each other, offer each other mutual support. On oxygen, I mean, even in countries where oxygen is done well, there are problems often with contractor performance. The companies providing the oxygen don't always provide adequate adequate training to patients in how to use the oxygen. There are problems in some countries where local respiratory nurses are thin on the ground, where it's difficult for patients to get reassessed, to get their prescriptions changed. And sometimes there's a failure by respiratory nurses to distinguish between the different oxygen needs of COPD patients and pulmonary fibrosis patients. But honestly, while these are real issues that we do need to address, they pale in significance to the one about oxygen equipment. Oxygen equipment is clunky, it's old-fashioned, it's heavy, it's difficult to use. I mean, it really is in need of a complete makeover. We need to bring in high-tech companies to look at this and say, how can we develop a system which meets the needs of patients? Finally, talking about the move to remote and virtual meetings and consultations, which has had a real boost, obviously, with COVID and is proving very effective. On the one hand, many patients really value this. They can have a quick 10-minute discussion with a doctor, get the points they need answered. They often have also got information they've collected themselves, spirometry, blood pressure, etc., which they can share with the doctor or have already shared electronically. So really good potential and good use there. Many patients very positive. But there's also a strong feeling among the patient community that it perhaps in some countries has gone too far, that the move to save money, to save resources by as far as possible putting consultations online means that patients don't feel they're getting that very important face-to-face contact, which is so essential. It's obviously very difficult post-COVID. There is a shortage of resources. It's not easy, but we still have to really fight our corner quite hard.